One more time. Good morning.
Good morning.
There we go. I want to be sure everybody's awake this morning. I want to thank you all for joining us here today. I would especially like to acknowledge Dr. Eric Makaitis, who is our interim CEO, Dr. Tom Nutter, who's Chief Behavioral Health Officer, Melva Brownlee, who is representing Commissioner Dennis Deere. Please keep him in your prayers. Maria Castillo, who's our Director of Ambulatory Behavioral Health Therapy and Social Work. She's probably got the longest title in the hospital system. Last month, we gathered for the first Cook County Behavioral Health Summit with more than 700 community and healthcare leaders in attendance. It underscored our collective drive to discuss and put in action plans to ensure access to equitable care for all residents of Cook County. It's going to take all of us working together to build a better health delivery system in Cook County. But as we all know, it also requires funding. During the COVID-19 pandemic, the federal government provided more than $130 billion to municipalities and counties across the country to make investments in their communities through the American Rescue Plan Act. Here in Cook County, we received extensive input from our residents to help us determine the needs that should receive priority funding. So we talked to our team internally, we talked to our commissioners, we had town hall meetings, there was a survey of our residents, we talked to our vendors and community-based organizations that we worked with. We cast a very wide net. And mental health, behavioral health care needs were among those issues that rose to the top. That's why I'm excited to be here today as we announce an open call for $44 million in grants to support community-based organizations working to improve behavioral health care for Cook County residents. That's $44 million. This is your government in action, creating new opportunities for local organizations to do their essential work in the communities that they serve. Cook County is investing in hyper-local behavioral health interventions because we know that we are stronger together as a city, as a county, and as a nation when we care for those who are too often left behind. Because mental illness knows no bounds, and the impact is far-reaching. There isn't a family in this country that isn't touched by mental health challenges. About 1 in 5 adults in the U.S. experienced mental illness in 2021, and nearly 17% of youth ages 6 to 17 have experienced a mental health disorder. Providing more support to individuals who would benefit from treatment will have a positive downstream effect on so many facets of our society, including our schools, our businesses, the judicial system, and more. Which is why this open call is important. With this infusion of funds, we aim to remove access barriers and provide treatment to treatment that people will be comfortable with. Cook County Health will provide details about the process and the awards, and I'd like to thank all the staff who are supporting this open call. All the people behind me, okay? A round of applause from me to them. The Cook County Health Team will provide details about the work and process and the awards, and I would like to thank all the staff who are supporting this open call. I look forward to seeing the innovative solutions awardees will propose to make Cook County a more equitable and healthy place to live, learn, work, and play. Now, I'd like to ask Melva Brownlee to come up next, and she is Chief of Staff representing Commissioner Deere. And I would ask each of the following speakers to introduce the person who succeeds them. Melva.
Thank you, Mr. President.
You're welcome.
Good morning, everyone.
Good morning, Melva.
Thank you, President Preckwinkle, Dr. Makaitis, Dr. Notter, the Cook County Health Board, where Commissioner Deere serves as Vice Chair, and the Cook County Board of Commissioners, where he serves as Chairman of the Health and Hospitals Committee. With immense pride and anticipation, the Office of Behavioral Health unveils its groundbreaking initiative, Stronger Together, Building a More Equitable Behavioral Health System in Cook County. Through this transformative $44 million investment, we embark on a bold mission to address the glaring inequities that spread through our behavioral health system ensuring that all residents have access to the essential care they deserve. Advancing health equity is the unshakable foundation of this initiative. Statistical data reveals approximately 1 in 5 adults in Cook County struggle with a mental health condition, while 1 in 12 adults experience substance abuse issues. These are not merely numbers, but human lives affected by the exhausting burden of mental illnesses and addiction. Recognizing the severity of this challenge, Cook County has embarked on a collaborative journey binding together healthcare providers, community organizations, and government agencies to improve behavioral health services. Through these partnerships, we have made significant strides in enhancing early intervention programs, increasing crisis response services, and promoting mental health awareness and education. Commissioner Deere is particularly excited about the bold steps we are taking now to address behavioral health disparities in our community. By addressing the root causes of behavioral health disparities, such as poverty, housing instability, and trauma, we can create a more equitable and just society for all. We are confident that through our collective efforts, we can make a real difference in the lives of struggling individuals with behavior challenges. Together, let us build a Cook County where everyone has the opportunity to live a healthy and fulfilling life. Next, you will hear from Dr. Eric Makaitis, Interim CEO of Cook County Health.
Good morning.
Good morning.
I'm Dr. Eric Makaitis, Interim CEO for Cook County Health. Thank you for being here with us today. It's always a good day when we get to announce that we're giving away millions of dollars to our communities. First, I'd like to thank President Preckwinkle for her support of the health system and the entire Cook County Board of Commissioners, particularly Commissioner Deere. It's thanks to their leadership that we have these ARPA funds to distribute and make a meaningful impact on the health and well-being of Cook County residents. I'd also like to recognize the Cook County Health Board of Directors, our own Office of Behavioral Health, and the entire CCH team working behind the scenes to administer this large-scale grant program. It takes so many people, from finance to strategy to community relations, to make this happen. As a physician, I know that a person's mental health is just as important as their physical health, and I see the tremendous needs that cut across all demographics of our communities. As a dad, I remain deeply concerned about the overwhelming youth mental health crisis. And as a friend and neighbor, I understand the important role everyone's mental health has in creating a resilient community, fostering successful relationships, and enabling individuals to thrive socially and economically. Through this grant program, Cook County government and Cook County Health are strengthening the capacity and collaboration of community organizations to advance behavioral health care across the region. It's critical that we invest in behavioral health services that are equitable, effective, and accessible. And we must do this while chipping away at the barriers of stigma that prevent people from seeking care in the first place. Cook County Health is proud to be a leader in supporting our regional network of behavioral health services, but we know to achieve this vision, it will take all of us working collectively towards the same goal. As President Preckwinkle mentioned, this grant opportunity comes on the heels of our successful Behavioral Health Summit last month, where we heard from stakeholders across the county about the current landscape and where we must go. Thanks to input from everyone at the summit, we've identified key areas where we'll be focusing the funding, including expansion of access to early intervention and prevention, treatment recovery and crisis assessment and care, as well as systems alignment and improving the quality of care. It's truly a privilege to be able to award the $44 million in grants to community-based organizations, providers, faith leaders, and others to accelerate the important work they do in our communities. The grant period opens today. Proposals are due by April 17th, and we'll be hosting informational sessions and workshops along the way. This is very exciting for us as an organization, and even more so for the organizations who will be using this funding to improve the lives of the individuals they serve. You'll hear more details about the program next, but before I finish, I want to give a special acknowledgement to Dr. Tom Nutter and Jennifer Brothers, who were the driving force behind this program. Thank you for your incredible work. And it's now my pleasure to introduce Dr. Tom Nutter, Cook County Health's Chief Behavioral Health Officer. Thank you.
Good morning.
Good morning.
Thank you to President Preckwinkle, to the Cook County Commissioners, with particular thanks to Commissioner Dr. Deere, Chair of the Health and Hospitals Committee and Cook County Health Board Vice Chair, and to Dr. Makaitis for their continued support of behavioral health and behavioral health care. We are deeply appreciative of this opportunity and honored to work under your leadership. We are also grateful for the federal support of mental health that has made these funds available. And thank you, Jennifer Brothers, CCH's Executive Director of the Impact Fund and Community Services, for your expertise, vigilance, and tireless efforts. Today, we are thrilled to announce this open call for $44 million in grant funding opportunities to help support the efforts and innovations of community organizations, schools, faith-based organizations, governmental agencies, and other healthcare organizations to meet the mental health needs of the communities they serve throughout Cook County. 3 weeks ago, we at Cook County Health had the privilege of convening the first ever Cook County-wide Behavioral Health Summit, an event which brought together approximately 300 organizations and over 700 participants for a day of structured listening. The topic-specific and region-specific perspectives gathered at the summit will not only be foundational for the crafting of a county-wide strategic plan this fall, stay tuned for that, but also will serve as a helpful guide as we review applications for the grant opportunities being announced today. A few details. The open call begins today and will remain open until April 17th. Organizations that are interested should visit cookcountyhealth.org/StrongerTogether, where they can find all the information they need about timelines, supports in the application process, and other questions they may have. We will be providing informational sessions about the open call this month, as well as optional virtual capacity building workshops to guide applicants through the application process and further assure fairness and equity in the selection of awardees. Recordings of these workshops will be made available online as well. The needs before us are vast and growing. The increasing prevalence of mental health disorders and the expanding gap between the demand and supply for these services have reached crisis levels, particularly in historically under-resourced communities. We at the Cook County Health Office of Behavioral Health consider this to be a generational opportunity to steward investment of resources into our systems of care and prevention, particularly into those under-resourced communities, and are eager not only to review the applications coming a few weeks from now, but also to come alongside the likely dozens of awardee organizations over the coming months and years as they develop new and community-based strategies to make a difference. Again, interested organizations should visit cookcountyhealth.org/StrongerTogether for more information. We look forward to being back here in June for the announcement of awards and very much look forward to the life-changing work that will grow from this initiative. And with that, it's my privilege to introduce my esteemed colleague, Maria Castillo, Director of Ambulatory Behavioral Health Therapy and Social Work for CCH.
Muchas gracias, Dr. Nutter. Hoy es un buen día para nuestras comunidades, para nuestras familias y el futuro de nuestras generaciones. Yo soy María Castillo, la directora de Terapia de Salud Mental y Trabajo Social de las clínicas ambulatorias. Nos complace anunciar hoy que Cook County está otorgando 44 millones en subvenciones para apoyar las organizaciones comunitarias, escuelas, iglesias y proveedores de salud, de cuidado médico para ampliar los servicios de salud mental. Estamos muy agradecidos de contar con esta importante financiación que fue proporcionada por el gobierno del condado de Cook a través de la ley del Plan de Rescate estadounidense. Esta es una oportunidad generación para invertir en programas que ayudan a las personas que luchan contra los problemas de salud mental y uso de sustancias. Estamos invitados a todos de las organizaciones comunitarias interesados en presentar propuestas para obtener subvenciones. La fecha límite para presentar solicitaciones es el 17 de abril. Cook County Health brinda el apoyo de las organizaciones que desean solicitar fondos, incluyendo talleres y sesiones informativas. Todos los detalles están disponibles en cookcountyhealth.org/strongertogether. Esperamos ver el trabajo transformatorio que respalda estas supervisiones. Y muchas gracias.
Thank you. Thank you. I'm always envious of people who can speak more than one language, since I can barely speak my own. All right. Questions?
The room? If not, I got one. What are the range of grants in terms of dollars that are available?
Dr. Nutter?
They'll be up to the
Yeah, you
grants.
can repeat the question.
The question was, what will be the range of grants? And the grants will range up to $1 million for the total of the grant period, which will be through the end of 2026.
All right.
More questions?
Going once?